in attesa che vengano montate le nuove slide.
So now we're going to have a new speaker, so we are waiting for the new slides to be loaded. I'm really honored to introduce you to Monsieur Christian Agrapart, coming from Paris. He's a physician, he's a neurologist, he's a psychiatrist, and he's an acupuncture expert on a European level, so he's very well known everywhere and is acknowledged for his activities. He teaches at university and he created and started the concept of chromatotherapy. And this is a registered brand. And he put together all his researches about color. So I think he's a special person because he would show us how colors and the frequencies inside the color may have a healthy impact on the body. And his studies are the result of traditional medicine and the studies on Chinese medicine. So now I give him the floor, and thank you very much, Monsieur Agrapart. So thank you for welcoming me. I'm really glad to be here with you today to present you and to introduce to you the concept of chromatotherapy, which is a method which I developed about 40 years ago, and I've been practicing it for 40 years. So 40 years ago, they thought I was a foolish guy, but today I still work. And my most recent works show that this kind of light rays, which I'm going to show you, they give us some insights to think over, especially from the scientific and medical point of view. So, starting from my discoveries, I created a chromatotherapy school, as well as an association, the STEREC, which gathers a high number of therapists and physicians.
Alors là, on passe. Ça, vous l'avez dit, hein, déjà. Vous l'avez traduit.
Okay, we have already translated this. We have already said that. Now, let's start with the definition of chromatotherapy. So we can distinguish luminous chromatotherapy and molecular chromatotherapy. The first one, that is to say the luminous chromatotherapy, exploits the white light which is projected on some filters. And these filters select some wavelength of the white light. That is to say that if we take a portion of the white light, the eye sees only a single color, that is to say monochromy. So you're going to see that these colors may be defined or are defined by wavelengths which are quite specific and precise. These wavelengths, whose therapeutical features and properties are well known, corresponds to the different shades of colors, and for example, red, orange, green, blue, yellow, and violet. Well, these wavelengths may be found in matter, and at the time being, for example, we have a precise effect which is absolutely comparable to light. chromatotherapy exploits 6 different colors. So here you can see the white light. You can see here the filters which will select the wavelengths of the light, and so we obtain a color, and this color will be irradiated on the different parts of the body. So now you can see that when the white light is projected on a prisma, the light is decomposed, is split in several colors. If the so that is to say the 6 primary colors, so red, orange, yellow, green, blue, and violet, or purple. When we talk about red, this doesn't mean anything, and this is what we understand from this picture. So you see that red has a value ranging from 750 nanometers and 610 nanometers. So it means that we have to choose within this range a wavelength whose effect must be a precise one. And these are the tools that we use. I dare say that this concept is a basic one. It's not the light and the power of the light which is important to us. What is important to us is the choice in terms of wavelength, and this is the most important detail. We can treat the most serious conditions and disorders simply by using a little portable torch. But what is important to us is the quality of the filter which will irradiate the information we need. So what we must know is, and I'm going to add something to what was said before me. So it means a piece of information that we already know. This is the reason why the power has not a fundamental role, a primary role. So I want to say right away that I'm not going to sell any possible kind of tool and device. So if you want any devices, you have to report it to some labs, but they have nothing to do with me, or better, I have nothing to do with them. So as you can see in this picture here, so you see a torch, you see the 6 basic filters. We can use some more, let's say, refined and complicated structures upon which we apply these filters. So we have a flashlight, as you can see here, with the filters. What you can see here on this picture, we have the device which we use during the acupuncture sessions, and as you can see, we also have a chronometer, which is basically important for us. The effect of each single color changes according to the exposure to this color. Now, as you can see here, the lab is made up of all these elements. So we have 3 different types of chromatotherapy. So we have the direct one, which consists in irradiating in a direct way, so one particular area of the body that anyhow has been, let's say, aggressed by any external factor. So it might have been a burn or a traumatic event or a post-surgical lesion. The second kind of chromatotherapy is the ocular one. We mean that we irradiate both eyes. So we treat some psychological problems as well. And then we have the chromatopuncture. This is the most evolved and the most advanced and complex form of chromatotherapy, which allows us to treat the so-called terrain. So it means that with one single point, we can treat the body as a whole. And so this is the direct chromatotherapy. So in this case, we had my dog who was suffering from chatalgia, so backache, and then here we have the direct chromatotherapy, which is combined with the acupuncture, so chromatopuncture. When you have filters generating precise and exact wavelengths, it is absolutely necessary to proceed with the treatment in pitch dark. Otherwise, you may create a sort of vague and confused piece of information that you are sending to the body. The exposure time may vary, so from 4 minutes or they may be even 50 seconds. Very often we use a color, and this color is associated to the complementary color. After the treatment has been finished, so the patients are transferred into a room, a black room, for about 20 minutes, and they are left in darkness. These treatments are performed once a week, because we must allow the patients to react normally after 3 or 4 days, and after these 3 or 4 days there is a reaction. Treatments must be close in time, but this may disturb the, let's say, the body response. This is a practical example. So here you have a person with elbow pain. So let's imagine arthrosis. So we irradiated 4 minutes red. Of course, we changed the filter in darkness. Then we had 50 seconds with a green filter. And then we had 25 minutes in full darkness.
Alors, les couleurs de la
Chromatotherapy colors are received and perceived by the living body and living human beings, but not only human beings. There might be animals, there might be plants. They are seen as climatic energies, and each single wavelength generates all the time the same response. Every time I use red, for example, we perceive a sensation of cold. On the contrary, orange is heat, green is perceived as humidity, something wet, blue is something dry, so it's a sort of dryness, while violet and purple, something dry and cold simultaneously, and yellow is perceived like heat joined with humidity. But be careful now. So everything looks theoretical, but no, it's not like that. All conditions may be classified according to these colors. Just to give you some practical examples. So you have a blue, you have a livid, so on an hematome. You normally use ice on this hematome, on this blue. But instead of applying some ice, you would use a red color. Well, you would be surprised. The reaction would be much higher than the relief you could get from ice, simply because red is decodified by the human beings or the living animals as something cold. So what we must understand is that living beings normally fits the information that is given. What's the meaning of all this? It adapts, and it has a response, a reaction, and it is basically important to distinguish the information which is conveyed by each single color from the response to that color. Just keep an example. So an information which is colored in red, and the organism will respond with the opposite energy. So if you send a cold information, the response, the reaction, is a hot response. And this response, this heat, which will, let's say, cause the therapeutical effort to become real. Just to give you an example, so you just burn yourself, and you have a sort of burn on your skin. So the sensation you felt was extreme heat. So I use orange, which I irradiate on the burn on the skin. This orange is decodified as heat. And at very moment, the body, the organism, will respond with a cold sensation, and so the burn stops. So it's a very simple thing. So every time I use red, which is decodified as cold, the response is heat. And every time I use orange, which is decodified as heat, the response is cold. And every time I use blue, which is decodified as something dry, the response is humidity, so something wet. Just to give you an example, this is used in beauty centers in case of dryness of the skin. And so every time I use green, it is perceived as humidity. Every time I use violet, which is decodified as cold and dry at the same time, the response will be humidity and heat together. The same thing applies to yellow, so the response is cold and dryness.
Alors, on va prendre quelques exemples.
Now we'll give some practical example so that you can understand that this is a medical reality, a scientific reality. Here, a victim of a road accident. She has an important scar, a laceration on the inside. And you can see there are some forms of suppuration. And the surgeon who visited her said, I cannot intervene before 6 months. I performed a chromatotherapy treatment, considering that the cold trauma, and I sent heat on the lesion, and here's the result. The effect 15 days afterwards, you can see that there have been some scarring process which were really and this is an example of keloid scar. The surgeon operated several times without obtaining any results, and we consider that this was a repetition, a trauma which was at the origin of the keloid scar. And we chose heat again, once again, and then the lesion went away, disappeared. We have an ulcer in a quadriplegic person. If there was less light, we could benefit from the visual of the bone underneath this sore. And this is an ulcer which dates back to several months before, and no treatment was effective. this ulcer appeared in this person after a massage, after a pressure. And we would like to perform a surgery with a. And here's the result after 24 hours, after 48 hours, when the patient was blocked has been blocked for several months. Here you can see that the sore and the scar closed very rapidly. Here a burn. The burn. A girl was suffering from this burn, and the family was concerned, was worried, because the situation was every day worse and worse. The part was irradiated with the orange color, and after half an hour, the pain was gone. After 5 days, the scarring process was completed. Here we have a burn case, which is even worse, severe. Here's a lady who underwent a facial burn, and she was treated at the hospital during 1 year. We performed chromatotherapy on the face of the lady, and after 3 weeks, you can see the difference clearly. After 2 months, we achieved this result, as you can see in the third photo. You must know that this kind of burns need treatments ranging from 1 to 3 years long, 3 year long. And this treatment is absolutely logical, as it's a disease, an energy disease. And it cannot be treated through matter because it's an energy disease. So heat entered, and we need to defeat this energy, but not using ointment, but we can achieve results with this treatment, with energy, in fact. Here, even worse pathology. This is a 3rd-degree burn. There's no basil. Normally, it wouldn't be possible. A scar wouldn't be possible, and as a consequence, we use tissue insert, and for this kind of lesion, we know that these inserts start to swell and proliferate. And the heat energy in this case gives heat to the insert, which begins to grow with this heat. And the scarring process happens gradually and with the diaphragm. So from the outskirts up until the inner part. As you can see, there's a hole that from the external part goes in, shrinks on the inner part, and we arrive to this achievement, to this result.
We get to a more complex part of what we already saw, but that is able to open many future possibilities, extraordinary ones especially. I am and acupuncture. I've been to China for this, and I worked on the role of acupuncture points, and I discovered that how acupuncture points are able to create a combined work. It's certain that the acupuncture point is an energetic concentration zone of cold, heat, humidity, and dryness. So we have to get closer to get close the color to the scar or the problem with all the energies that we already saw, because there is a perfect correspondence among them. Since every color corresponds to a particular color of the rainbow, I didn't change my voice. Just the interpreter it's different now. The interest for this correspondence between energy and color is that for the rainbow color, these are in a very precise situation, in a very precise position. So we can start from this principle based on using acupuncture as we use colors of the rainbow. Goethe is the first one to think about putting colors in circular disposition. Colors of chromatoherapy are quite different. You can see that you see the yin and yang energies. So we have the heat and cold, and on the other side we have dryness and humidity. This helps us to position perfectly every acupuncture points rather than other ones. So we have a rotating color circle in a longitudinal way for the limbs. On the longitudinal plan, we can see that if I use red color, the circle rotates in this way, and we can get orange. This is the shoulder, the elbow, and the forearm. So we know that every time I use red on the shoulder, I will have orange on this level, on the other level that I'm showing you. So it means that every time I use cold on the shoulder level, I will have heat in the forearm. You can see the circle rotating. Every time I use a color on the shoulder level, the circle is going to rotate on the longitudinal level. What's very important is that when I choose a particular position, I have to know the color is going to appear on the other level. It takes place longitudinally. It can be quite difficult to understand, but I think it's a very important theme rather than the one that was presented before. Considering transversal position, this position of the circle, By using it in this way, I can understand acupuncture benefits on the meridians. I find on the transversal disposition, I find every meridian. Sorry, I use it on longitudinally, so using all the sequences I already showed you, but any on the transversal days. So we can find every meridians of acupuncture by using the same principle. We already saw it, so I go a little bit faster. In every 3 dramatic description, there is a particular meridian. And every time I use red, all the sequence is going to be completed, we can say. So every time I use red on the wrist, I will cause cold, sorry. And if I use blue on the same point, I will have a different, I will have heat. Never before we have seen such precise acupuncture use for treatments, especially for disorders and pathologies that were stopped over the years. So let's make another example now. Person that has a wrist problem and pain. I see that in the meridian there is an excess of humidity, and if I try to solve it from the central point of view, what's really important to notice is that our body is a whole, and we have to understand every singular position and any singular painful area. So it's not possible to isolate a particular matter to solve it. This helps us to treat people with particular and severe problems, health problems like psoriasis. You can see pictures in front of you. The patient, was able to heal because of thanks to chromatotherapy. You know what's the macularity degenerances? Yeah.
So macular degeneration normally is in a person who has a reduction of this hypersensibility, a deformation of the lines of the eyes, and the central vision is blackened. So I want to tell you that I went to the United States to explain ophthalmologists and oculists how to treat this pathology, this condition. And so I'm going to give you a practical example. This is a subject who has a particular condition on the retina. So here you can see much better. And this was treated on November the 19th, 2014, and subsequently on January the 29th, 2015. As you can see here in this image, under the retina, there are some vessels deforming the retina, and they cause the perception, or better, the bad perception of straight lines. The fact that we have treated by means of chromatotherapy, simply by placing a needle, so acupuncture, the pathology was solved, the pathology was disappeared. So here you can see the same person, and you can see the the vessels which may bleed within the eyes. On the 29th of January 2015, the condition was sensibly reduced. And as you can see here, these are the conclusions of the hospital. So the decrease of the epurative liquids, the patient was subject to different sessions of chromatotherapy around the end of November 2015. So there is no pathology any longer at the level of the eyes. And at the moment, no other therapy may reach the same results. I can't say anything else due to a lack of time. As far as some psychological issues are concerned, let's say that every wavelength has a specific aspect. We must think that this system is a threefold system. So we have psychism, soma, and energy. These systems are interrelated and they are in a perfect balance. They are in continuous interaction. We must know some basics of Chinese traditional medicine. There are some European interpretations and European discoveries of some principles which are commonly used in traditional Chinese medicine. But this is not just a Chinese theory. This is a European theory. Each energy, wetness, cold, dryness, correspond to a particular organ. So, for example, humidity corresponds to the lungs, coldness to the heart. So each organ in our body can create particular energies. And when we have energies, energies must be stimulated. Each energy has a particular impact and reflection on this psychological point of view. So heat, for example, accelerates intellectual operations. Cold slows down the flow of information. Humidity stimulates the intellect, while dryness allows a better coordination of our thought. Some activities have a tendency to use one or the other energy. So, for example, if somebody asks me one particular kind of energy rather than another kind of energy, normally tends to exhaust these energy. And this, of course, leads to possible psychological problems and psychic problems. Likewise, we may have an excess of energy, and when we have this, let's say, additional energy, we may have some particular pathologies or some particular disorders. For example, schizophrenia, which is normally due to an excess of humidity. Then we have cold, for example, which may be the source of particular conditions. And indeed, we say that normally in winter, depressions are due to the lack of light, but this is not true. It's simply due to the inability of our organism to produce heat. So it is just enough to tonify the kidney in order to abate and soothe the winter depression. This treatment is far more efficient than medical treatments, for example. So we expose the patients to light The excess of dryness corresponds to particularly serious depressive state, so people that may be induced to commit suicide. All this involves a basic dryness. So heat, on the contrary, may be a source of excitement, overexcitement, and excitation. Probably you have heard about some particular events like foolishness, for example, and this pathology, this condition is strictly related to this disorder. So chromatotherapy is a medical procedure, is a medical act. So a diagnosis is necessary as well as a precise therapeutic program. It is a particularly favorable treatment, and it has great effects. This enhances the ability of our body to adapt in a very rapid way.
Plan psychique.
I'm going to talk to you about the effects on psyche, but it's not a limit. I will talk about psychiatry because this is my field of expertise, and there are several effects in physical disease and disorders which are influenced by these traditional therapies. The bipolar depression, there's no need for drugs. Then winter depression, some confusional hallucinatory states in schizophrenics, first stage schizophrenics. For example, a girl with her brother, he was really afraid of her sister while she was having seizures and attacks, and he was terrified, and he would think that she would think that his brother was Dracula. And seeing her in this state, I told him and I told them that I wouldn't treat her at home, but instead at the hospital in a clinical way, but only if she agrees to be hospitalized. And the treatment was the ocular grain the day after being hospitalized. The mental confusion disappeared. So we must not underestimate light even in the most severe diseases. We talked about psychosis. If psychosis are old and are treated for a number of years, the treatment could be complicated because there are a series of damages which can be verified through modern tests. You have puerperal psychosis, which were hallucinator, and women suffer from that after giving birth, after delivery. And these psychoses are due to a sort of breakdown of the woman's body. And breakdown, they run out of energy, and this can be stopped very rapidly. You have all cranial trauma, and I explained to you that trauma means cold. So it is enough to bring heat on these traumas in order to have positive effects. We can have a normalization of ECG, which normally presents abnormal levels. And as you can see, we have some patients that were in specialized departments, wards, and when the trauma is severe, there are specific wards, divisions, and they give sanitary assistance. There were patients in about to die, but then the treatment worked. As for embolic stroke and CVA, the effects are really rapid. The sooner we intervene, the better. If we intervene, if the intervention is too late, there are some cells that cannot be defeated. I had a friend of mine came to us and during a meal told me, I don't know what happens to me. I cannot move my right arm. I panicked. We need to hospitalize him. And I told him, no, my praxis is here in the yard. Come with me. I irradiated the cranial part corresponding to the arm, and after 30 minutes, he could move his arm. But be careful, attention, because it's not because he was cured with chromatotherapy. We did not stop because of this result. We had to make him hospitalized to understand why this episode of embolic stroke occurred. We mustn't say that this is the only way and give up on traditional medicine. We need to use the both of them. And he was cured at the hospital, treated at the hospital, and we talked about it and we understood what was the origin of the embolic stroke, of the clot. So we have to combine both sciences. Chromatotherapy is not against medicine. I must be clear, we must be clear. We need to follow a path, a joint path of the two methods. I've worked a lot on Parkinson's disease, and it is clear that there is a deceleration of the evolution of the disease, multiple sclerosis, and Alzheimer's disease. I would like to talk about Alzheimer's disease because we've just talked about it. What's Alzheimer's? We need to define it. It's not only an excitement state. Alzheimer's is, first of all, a short-term memory disorder. They remember about the past, but these subjects are unable to remember the present. It's a disorder of the spatial temporal orienting. And if we carry out an exam, we found some lesions in the hippocampus region. And what I can say is that with chromatotherapy combined with acupuncture, people lead normal lives, and none of them can believe that they suffer from Alzheimer's disease. So these are very powerful effects. Several diseases, somatopsychic disease. We have rectocolitis, ulcerous. Then we go faster and faster. I have only 5 more minutes, and I think I ran out of time, and I cannot continue on this point, and I will just say, no, one moment, I will go back, and here
the books. They asked me several times to present my books. Here are the guidelines for the chromatotherapy. When color is able to heal, and for acupuncture points, it is not possible to have an access because you must know something, be an inner practitioner. So I will answer your questions, or you can have my documents on chromatotherapy. The text is in English. I thank you very much. Thank you so much for your attention.
Grazie mille, dottor Agrapart. Cristian, grazie. Grazie.
Merci, merci beaucoup. Merci.
Grazie.
Thank you so much for participating.